5 diabetic emergencies you must be aware of. They are severe, often life-threatening conditions that require immediate medical attention. The main diabetic emergencies are: 1. Severe hypoglycemia, caused by extremely low blood glucose levels, often due to excessive insulin, missed meals, or intense exercise. Could also be caused by a wrong medication regimen including oral medications. Symptoms: sweating, trembling, confusion, slurred speech, and loss of consciousness. Hypoglycemia treatment is the immediate consumption of fast-acting carbohydrates, for example, glucose tablets or juice. If the person is unconscious, intravenous glucose is the only option. Do not take solid foods as they can cause choking, so the best is sugar-sweetened beverages. But if nothing is available immediately, better to take whatever available carbohydrate including fruits or snacks. Remember, it is always wise to have something handy in the pocket. 2. Diabetic Ketoacidosis, or DKA for short, caused by lack of insulin leading to high blood glucose and ketone levels. This is caused by a severe lack of insulin in the body. This leads to high blood glucose and ketone levels, often triggered by infection, illness, missed insulin doses, or new-onset diabetes. This could also be caused by missed oral diabetic medication in individuals with type 2 diabetes. Symptoms: nausea, vomiting, abdominal pain, fruity scented breath, rapid breathing, confusion, and dehydration. Treatment: intravenous fluids, insulin therapy, and electrolyte replacement. 3. Hyperglycaemic state, or HHS. Reasons: consuming excessive amounts of carbohydrates, insufficient insulin production or insulin dose, if insulin injections are used, missing or incorrect dose of insulin or oral diabetic medications, lack of regular physical activity, hormonal changes during puberty, pregnancy that is gestational diabetes, or menopause. These can affect blood glucose levels. Physical or emotional stress, illness and infections can cause the body to release stress hormones that raise blood sugar levels. Some medications, such as corticosteroids, diuretics, and certain psychiatric medications, can raise blood glucose levels. Other medical conditions like polycystic ovary syndrome in women cause extremely high blood glucose levels without significant ketone production. Symptoms: severe dehydration, confusion, seizures, and coma. Treatment: intravenous fluids, insulin therapy, and electrolyte replacement. Wait, there is more, but do not forget to hit the like button if you have found this video useful so far. 4. Lactic acidosis, caused by accumulation of lactic acid in the body, often related to certain diabetes medications including metformin. But, with underlying conditions, the reported frequency of lactic acidosis is 6 per 100,000 patient years, mostly in patients with predisposing factors. Other reasons for lactic acidosis include intense exercise but resolves with rest, liver dysfunction, severe dehydration, conditions like heart failure or cardiac arrest, severe infections, sepsis, metformin, especially in patients with renal impairment or those experiencing dehydration or heart failure. Symptoms: nausea, vomiting, muscle pain, rapid breathing, and severe fatigue. Treatment: addressing the underlying cause, discontinuing the offending medication, and supportive care, including intravenous fluids and bicarbonate in severe cases. 5. Diabetic foot infections. Reasons: damage to the nerves in the feet and legs due to prolonged high blood sugar levels, thus leading to not knowing there is a foot infection. Reduced blood flow to the extremities due to narrowed or blocked blood vessels that decreased the ability to heal wounds and increased the risk of infection. Chronic hyperglycemia causes impaired immune function and delayed wound healing. Conditions such as pancreatitis, Cushing's syndrome, and polycystic ovary syndrome or PCOS can contribute to hyperglycemia. Cause: poor blood circulation and nerve damage in the feet, leading to ulcers and infections. Symptoms: redness, swelling, warmth, and discharge from the affected area. Fever may also be present. Treatment: antibiotics, wound care, and in severe cases, surgical intervention. Recognizing the signs and symptoms of these emergencies and seeking prompt medical attention can significantly improve outcomes. Regular monitoring and proper diabetes management are key to preventing these emergencies. Consult your healthcare professional before changing your medication or lifestyle.